Yeah, acupuncture is actually one of the oldest medicines around. I think it's kind of funny when people talk about it being an alternative medicine because it's really probably what I would consider the original medicine. It is thousands of years old. And what most people don't realize is that way back then, doctors were acupuncturists. And people went and saw their acupuncturist or their doctor on a regular basis to stay healthy, to basically maintain their health. If they were happen to fall ill or get sick, they would continue to see their acupuncturist, but now they would actually stop paying them because their acupuncturist failed their job, which was to keep them healthy. So once they got healthy again, the acupuncturist slash doctor would start getting paid again, and everybody would be happy and healthy. So when you first come to see me for your initial session, there will be a brief little health intake form I'll have you fill out. We use that form as a basis for our initial discussion. So our 90 minutes together, our first 20 to 30 minutes is you and I just sitting down comfortably and discussing your health history, but more importantly, what's working well or not working well for you right now. What things would you like to see better? And then we do a brief little physical, I call it Chinese style. I'll take 12 different pulses from you. I'll also look at your tongue and your eyes, and I use that information to just give me a better picture of what maybe is going on internally that needs a little bit of attention or adjustment. And then after that, we get started with the first treatment. During this time, I'm developing both a short-term and a long-term treatment plans to help address any sort of stagnation or blockages that may be causing your systems for not communicating or reacting in an appropriate manner. We can get these blockages or stagnation internally by all sorts of things. So stress is certainly one of those things. Injuries, illness, surgeries, there's all sorts of things that can cause our chi to stagnate or get blocked, and then that happens, then our internal systems are no longer able to function in an appropriate manner. Yeah, so Qi is that vital life force that carries energy and resources to every part of our body. Our glands, our tissues, our organs, every part of us needs vital energy in order to perform and continue to live. So Qi flows along what we call meridians. So there's 12 primary meridians in the body that are carrying Qi and energy and resources all around. Think of them kind of like garden hoses. So the first one connects to the second one, and so on and so forth. And then the 12th meridian connects all the way back to the first one. So it creates this circuit within us of energy that's constantly moving and traveling around and reacting to situations that may need extra attention. Everyone should be coming in for acupuncture is the short answer. It just depends if you're coming in more for a preventative maintenance, so everything is working well and going well and I just want to make sure I stay this way. So by having our discussion and listening to the pulses and looking at the tongue and the eye, I can often catch these imbalances in their early stages before they wreak havoc and become bigger nuisances in your life. If you do have something going on that's not working, then that's an even better reason to come in and get acupuncture. So I get patients that come to me from everything from stress, depression, and anxiety to chronic back pain, neck pain, migraines, to acute things that have just recently popped up. So it runs the range of pretty much everything. And I tell people all the time that it's definitely worth a try if you haven't tried acupuncture to adjust whatever your health challenges may be. Worst case scenario is that it just doesn't seem like it's working. There's definitely no downsides to it. Absolutely. So for oncology patients, what we're doing is we're supporting all of these systems. They are supporting the immune system, we're supporting their energy levels, we're helping trying to balance out the side effects of any sort of cancer treatments they may be going through, like chemo and radiation or any sort of medications they're going to be on for long term. All of these things have side effects while they're trying to in the long term help benefit the patient and obviously get them on the road to recovery and on the other side of cancer. But they all have their potential side effects, some less, some more. So what acupuncture is great at is keeping energy levels going, keep the immune system supported, and at the same time keep these potential side effects at a minimum. Absolutely. So for one, I love helping women get pregnant, first of all. It's an amazing way to beat some of the fertility challenges that a lot of couples are challenged with. So first thing is, let's get pregnant. Then the second thing is supporting you during that pregnancy. So acupuncture can be used from the very beginning of pregnancy all the way up through delivery. There are certainly certain points that are not used at certain points of the pregnancy, but other than that, I fully support and encourage pregnant women to get acupuncture all throughout their pregnancy, as well as afterwards. After having a baby, no matter, it could be the healthiest pregnancy and the best delivery ever, it still is a lot on your body and all of your systems. And so acupuncture is a great way to kind of jumpstart that whole recovery process and help get mommy feeling back to pre-pregnancy as much as possible, as quickly as possible. One of them that I think is probably the first and foremost is that I hate needles. And my first response back is, join the club. Nobody likes needles, at least I've not met anybody that says they love needles. But these needles are super, super tiny, thin needles. If you took 2 or 3 of your hair strands and put them together, that's what we're talking about for the needle. So it's not like getting your blood drawn or getting a shot by any stretch of the imagination. Another common question I get is, will it hurt? And I will say, I'm not going to say 100% that it won't, but if you do feel anything, what you're going to feel is something similar to just the tiniest little prick as the needle is going into the skin. Once the needle's in, most people feel very relaxed and feel nothing at all. Some people do report that they feel a little bit of a chi sensation, which can feel like a warming sensation or a little bit of a tingling or a buzzy feeling, but overall everybody just reports feeling very calm and relaxed, and quite often people will fall asleep on my table, which is great. And then I think the next most common question I have is, how many needles are you going to use? Am I going to look like a porcupine when you're done? And the answer to that is no, absolutely not. My whole point in all of this is less is more, and trying to acquire some sort of balance and pathway to health using as few as needles as possible. So my goal is to pick points that have multi-purposes and can support you in multiple ways with using just a handful of points or so. And I think that's about it.